Good evening, I'm Sandy Thompson, your host of Life Ahead here on PBS 39. What is Life Ahead? Well, it's a great show we have here to provide you with education and information that will help you make choices in your life ahead. I'm guessing that a lot of you right now are beginning to make some choices when it has to do with health insurance and Medicare and open enrollment and advantage plans and supplements. What is what and what's best for you? Well, we have a very special guest here for you this evening to answer any of the phone calls that you might make to us here to help you with your guidance in choosing what's right for you. Please meet Greg McDonald. He's no stranger to us here on PBS. Greg, so nice to have you back with us here on Life Ahead.
Great to be back, Sandy. To see you again.
And Greg has been with us 4 times now on Life Ahead.
Yeah, it's number 5.
This is number 5. I think that's a good luck omen, Greg.
I hope so.
And Greg has handled a lot of phone calls from our viewers, and again, we encourage you to give us a call if you have questions concerning anything here tonight about health insurance, 969-2720. Now, we're going to focus on Medicare and Advantage plans and supplements, but if you have some other health insurance plan or question, you'll answer it. Would that be correct?
I'll give it my best shot.
All right. Okay. All right. I want to start out with just kind of some simple explanations, okay. Greg. We're now in the beginning of open enrollment. And what does open enrollment mean, and how long does it last?
Well, it's actually called annual enrollment.
Annual enrollment?
Annual enrollment. And the reason I make that distinction is annual enrollment deals with Medicare.
Okay.
And the Medicare annual enrollment period begins October 15th and runs through December 7th.
Okay. Is it the same period every year?
It is.
Okay.
It is. Now, the reason I distinguish it is because people under the age of 65 that are getting on individual health plans, that's open enrollment.
That's the difference.
That's the difference, and that begins this year, and it seems to have changed every time in the last 3 years. This year it begins November 1st. And it runs through January 31st.
I'm glad you explained that. And I just had lunch today with some friends, and I know they're not on Medicare yet, but they were talking about, well, I've got some decisions to make. It's open enrollment, and I thought, why are you making open enrollment decisions? So that has to do with like your health insurance at work. Yes?
No.
No?
Or it can. Individual enrollment, when I talk about that, we're talking about individual health plans.
Okay.
Employers are group plans, and they can renew any time during the year.
So they don't have necessarily an open enrollment, if you will.
They have an open enrollment for their particular plan where people can change, they can add dependents, do that type of thing. But what I'm referring to here are the individual plans. This is the Affordable Care Act, what people call Obamacare.
Right.
Okay, those are the open enrollment periods I'm talking about.
And then annual enrollment is the term we're going to use now tonight when it has to do with Medicare. Right. Okay, if you have not yet received your Medicare and you a booklet for 2016, we'll give you some information at the end of the show, a website and a phone number where you can call if you've not received yours in the mail. Pretty good book, awful lot in here.
A lot of stuff, a lot of good stuff.
Are there a lot of changes every year?
With basic Medicare, no. The premiums can change a little bit. Some of the co-pays and deductibles and co-insurance with Medicare can change a little bit. But no, not anything drastic. And they have not announced what the changes are at the time of this show, what they're going to be for 2016 yet.
When will we know if there are going to be changes?
Generally, those will be announced the end of October, could be the 1st of November, but we should know soon.
And I know you're going to be with us again here next week, by the way. If you don't get a chance to call in tonight, Greg's going to be right here next Wednesday night at 7:30. So you've got a whole week to think up some good questions to try to stump him. All right, let's talk about the difference between a supplement and an advantage plan. It's kind of a tricky thing.
Well, it really boils down to who pays the bill.
Everything's about money, Greg.
Everything is about money. So we have original Medicare. When people have Part A, which is hospitalizations, and Part B, which is your doctors.
Yes.
That's original Medicare.
Right.
Now, people often have put alongside original Medicare a supplement. What happens in that case is when a claim is made, Medicare pays first, and then the supplement will pay whatever that plan particular pays.
Okay.
With an Advantage plan, when a claim is made, the insurance company pays the claim, and then the policyholder will pay a copay or a coinsurance, whatever
that's
that
when
plan
you're
requires.
paying your copay at the doctor's office.
Correct.
$20, $30, or depending on.
Depending on the plan.
Yeah, exactly. Okay. So it depends on who's paying for it. How do you know, Greg? And this is the hard part, I think. How do you know what's right for you? Advantage plan, supplement.
I always ask people after we explain it, which one do you think you feel more secure with? Which one allows you to sleep better at night? They're both going to work. It's a matter of which one do you think will work better for you. Some people like the security and the freedom that a Medicare supplement gives.
Because you could go to the doctor 5 times that month and you're not paying a copay, or
It could
you
be,
could
yeah.
not go for 6 months.
Well, and for example, if the most popular Medicare supplement plan is a Plan F,
Okay.
With a Plan F, there are no copays, there are no deductibles. Plan F and Medicare will pay all your bills.
Okay.
And it's good anywhere in the country. There are no networks. The supplement changes with Medicare changes in their deductibles and copayments. So it's a nice, easy plan to have.
And maybe, I'm just guessing, but theoretically, maybe that's a nice avenue for people who travel a lot or spend the winter in Florida.
Exactly.
Or where they can go any doctor they want and they don't have to worry about anything.
Exactly. And for people with chronic health conditions, those are super, because that way they don't have to worry about which doctor can they go to. They can go to Mayo Clinic, they can go to Cleveland Clinic, they can go to IU Med Center. I mean, they don't have to worry about, am I covered? As long as it's a Medicare covered expense, Medicare and your supplement will pay for it.
But now, is the price that you pay for Plan F more than you'd pay for most Advantage plans?
Yes.
Okay,
Yes.
because bottom line, you are going to pay. It's just
You're
like
going to pay.
who you're going to pay.
Oh yeah, it's a matter of how do you want to pay it.
Yeah.
If you have a Plan F, it's almost like having a fixed cost for your medical expenses. You can pretty much budget it for the year. And so if you're going to pay, let's just pick a number, $150 a month, that's going to pay for all your medical expenses that year. Okay? With an Advantage plan, the premiums are lower.
Okay.
In Allen County this year, for example, we're going to have 5 different plans that have no premium. Okay.
Is that new this year,
Well,
or
it varies.
are those
No,
5?
we've had different plans, and it varies a little bit every year. But this year, I think there's going to be 5.
Okay.
And with that, you're not paying a premium every month like you do with a supplement.
Okay.
But when you go to the doctor, you will pay something. And if you go into the hospital, you will pay something. So it's a matter of how do you want to pay it? Do you want to pay it like a fixed cost and have everything taken care of? Or do you want to pay as you go?
Okay. We have a phone call already.
All right, super.
See, I knew we'd get phone calls. This is such a hot topic here tonight. Bill has phoned in, and by the way, Bill, like maybe some of you, prefers to not talk live on the air, so our phone operator, James, is back in the control room. He'll take your questions and type them up for me to read to Greg here tonight on the teleprompter, but if you will talk live to us, we love that as well. Okay, Bill has called in, and he says, why is it advertised as 0 payment and then a year later was billed monthly? People on a limited income are unable to afford this.
Great question, Bill. What happens is the plans change every year. That's the thing with a Medicare Advantage plan.
Okay.
The plans can change every year, and they do. And so oftentimes I've seen companies come in that have no premium, and the next year it goes up. And maybe the next year it goes up again. I've actually seen one this year that had a premium and went down to a zero premium. So it moves. And that's why when a person has an Advantage plan, it makes sense to shop every year. In late September, Advantage plans will send out what they call the annual notice of change. It's a big document, and like most people, you pick it out, it's insurance stuff, you look it up, it's like Greek,
and
it's
you don't
like,
want to read all
I
that.
this now.
But you should.
But you should, because that's going to tell you what changes are going to happen. And if you ignore it, and you just say, well, my plan worked for me this year, I'll just let it go. And then you get into January and February, and you go to the doctor, and it's like, whoa, what is this? I'm getting charged for this now? Oh, this drug is no longer on my plan, and I got a premium? That's why you need to check it out.
So we have to take responsibility ourselves to be informed. And I'm gathering, and I don't want to answer this question for you, Ben. You can disagree with me, Greg, but I'm guessing that for Bill or for any of you, Bill that just called in, or any of you out there, we have to take responsibility ourselves to read the supplement that comes in the mail with our insurance information. The policy changes. Is that what it says?
Pretty much. And this is one of the
changes?
advantages of a Medicare supplement, okay? With a supplement, it's not really going to change, other than your premium.
So you may be paying more or less.
I tell people when they sign up first.
Usually more.
Yeah, with a supplement, I said one thing I can guarantee, it's going to cost you more every year.
Yeah.
Okay, because they're going to go up. With Advantage plans, it's not just the premium. The premium may remain the same, but what's inside? What do they cover? What are the co-pays? All those things can change a little bit. And so it really is important that a person takes time and looks at that. And if they don't really understand it, contact somebody who does.
Right. That was the second point that I was going to make. You need to do your own homework and read the policy changes, and or get a hold of somebody like Greg that knows them all, and he has to do his homework all year long to stay updated with all the changes for all the different insurance companies. We have another phone call. We have Martha on the line tonight. Martha, thank you so much for watching. And what is your question for Greg tonight?
My question is that the state of Indiana don't allow you to get a Medicaid supplemental plan until you're 65 and older.
Uh-huh.
If you disable, can't work, have to quit work and get on Social Security, you have to go with just the Medicaid or the Medicare Advantage plan. And then when you go to the doctor, it's like $45 for specials and $15 for your doctors, and then tests in between there that the insurance say is not medical necessary, and they won't pay for those. And then, like, if you get a colonoscopy, it's $200 and some, or a scope, a heart scan. That's a lot of money coming out of your pocket with an Advantage plan, and you're on a fixed income.
All right. How can you respond to Martha, Greg?
Well, that's a great point, Martha. And I think, let me go between the two terms. Medicaid is a state-run program. And when a person's on Medicaid, it's typically low income. Medicare is the federal system that comes in. When a person is eligible for Medicare and Medicaid, they're called dual eligible. And in that case, the state actually, Medicaid acts as a supplement. But I'm thinking in your case, what you have is you're under the age of 65, you are disabled, you are on Medicare. There are Medicare supplements that a person can buy. There's not many of them, and they're very expensive. And the reason for it is the insurance companies know that if you're under the age of 65 and you are on Medicare, you have health issues. They're in the business to make money. And so they're going to charge a premium, what they consider appropriate to what they think they're going to have to spend for you. For people under the age of 65, Advantage plans tend to work better because they're more affordable. Now, if you're on Medicaid, you don't want an Advantage plan, just stay on Medicaid. they're going to give you or assign you a prescription drug plan to take care of your drug costs. But for most, a Medicare Advantage plan will work better than just original Medicare in those cases, keeping your co-payments low. I know it's not as good as a Plan F supplement, but often that's the best we can do.
Okay, hopefully, Martha, that's helped give you some good insight, and it's an expert opinion, so hopefully that was helpful for you. All right, Greg, I know that was a challenging
Oh, I get that quite a bit.
Do you?
Oh, yeah, all the time, because people will get on disability, and one of the things that is unfortunate is they have to wait 2 years before they're eligible for Medicare. So they have this 2-year wait before they're even eligible to get on. And then once they get on, they don't have access to all the different Medicare plans until they turn 65. So I understand it. It's not as nice a position as one wants to be in. We just try to make the best of what we have.
Right. So just, you know, do the best you can in terms of getting information and insight and making decisions until you do reach 65. Right. I'm sorry, Martha, that it's a difficult situation for you. Again, the number here is 969-2720. If you have a question, please give us a call here. All right, let's try to simplify this just a little bit, going back to the differences between Advantage plans and supplements. Let's take them one at a time. What are the upsides or the good things about a supplement, and what are the disadvantages of a supplement?
Supplements are easy to manage because once you have it, it automatically adjusts to whatever Medicare is doing. Okay. And so you don't have any changes really that you have to deal with, aside from a premium increase. No networks.
But during that year, it's the same amount you pay every month. Yes?
Could be.
But you don't know. It could
What
increase.
happens, and the reason I tell people that I can guarantee you the price is going to go up every year. Every year, the companies will have a price adjustment, which is based upon inflation and what's going on in the medical field. Then, as you get older, most of these supplements are what they call attained age. So every year you get older, it ticks up a little bit. Well, so let's say you have a birthday in May, and you have a price increase. And then the company has their annual price increase in August. I get phone calls. These dirty dogs increased my prices twice this year. Yeah, they did. And I can tell you it's going to happen again next year. That's the thing with supplements. But aside from that...
So you just don't know.
You just have to kind of work with it. Aside from that, though, they're great in that, as I said, no networks. You can go whatever you want to. It's going to take care of your expenses.
You don't have to worry about in-network providers.
In-network, out-of-network. You can go anywhere you want, anywhere in the country. Take it with you. Advantage plans tend to be specific to a locality. They're going to have networks involved with them. You're going to have to know, is your doctor in, is your doctor out? If he's out, what are you going to pay for it? Because you'll pay more out-of-network than in-network. But the plus with Advantage plans, they'll have medical and prescriptions all in one, and the premiums are lower, and sometimes they'll add some extra bennies in there like teeth cleaning, gym membership, eye exam, dental exam, that type of thing.
Okay, all right. And now on to Advantage plans, or do you feel like you've explained both
I think
ups and downs?
Okay. That's a good synopsis.
You know what we haven't talked about a lot are drugs. You want to talk about drugs with me tonight?
Hey.
Do you have questions about drugs? No. Oh, actually, we want to talk about Part D, but let's pause for just a moment because Frank is on the line. We don't want to make you wait, Frank. Thanks for calling, and what is your question tonight?
Yes, I want to know what the difference is between a D on the prescription plan and an F.
There you go.
I never heard of an F.
We are going to talk about Part D. And
the thing about Medicare, it's an alphabet soup. You have Part A, Part B, Part C, Part D, and then you have Medicare supplement plans, and they letter those too, and there's 10 different plans. And so, is it confusing? Absolutely. So what happens is, with Part D, that's a drug plan, okay? So D is drugs.
D is for drugs.
Now, what's confusing? There's also Medicare Supplement Plan D. That has nothing to do with drugs. Plan F, none of the supplements are going to contain prescription drug coverage. Now, they will cover drugs that are administered in a doctor's office, in a hospital, chemotherapy type drugs, or
okay.
those types of things. The supplements will cover. But they're not going to cover your Crestor at Walgreens. Okay? That's why you need your Part D plan.
Frank, does that answer your question, or is it still confusing?
Well, I'm wondering if you get a supplement, and you have to take a D in order to get a prescription plan. I mean, but what does the prescription plan cover? I mean, does it cover all the drugs, or is it covered with a copay?
No, and what happens is all of these plans are going to be copay specific. I mean, each plan is going to have their own formulary or their list of drugs that they cover. And you'll have a certain company might offer 3-4 drug plans. They could all have different formularies, different amount of drugs, or the types of drugs that they cover. They're going to have different rates, copays for those drugs. The only plans that I know of that cover a drug at no cost are those that will say a zero premium for generics if you use their mail order service. That's it. There's no freebies going to the pharmacy. Now, I know some of the pharmacies offer some like that, and I tell people if you can get them, great, go for it.
Yeah. Sometimes they're just promotional. Sometimes maybe it's
they're
a
promotional
one-time
ones
thing.
Exactly, to get them in there. But that's why a person needs to examine these drug plans carefully to see what's in it, what's not. The cheapest drug plan on the market, it's like, wow, I can get into that. Doesn't mean it's going to be the cheapest plan. It could be actually an expensive drug plan, may be the cheapest when you consider all the cost over the course of a year, because the copays are lower for the drugs.
Right. And from what you were telling me earlier, from year to year, you can actually have changes within your own insurance company in terms of drugs. I mean, something that may be a certain price one year or at a certain level or tier, if you will, can be moved to another. How do we know that in advance?
That annual notice of change. You have to look at that annual notice of change. But also, that's why it makes sense to shop these things and look. You can go to Medicare.gov. If you're get online, you can type in the information, and it will give that information to you. You can compare the drugs that way and compare the plans, see what it costs, what pharmacists they use.
All this will be listed at Medicare.gov, Greg?
Yes. Yes.
Okay.
And it's a fairly easy website to navigate.
So you can check on prescription costs from insurance company to insurance company?
Yes. Yes.
Okay. Now, that 1-800 number that was up there, and we'll give you that again here in just a few minutes. Would they tell you that on the phone, or direct you to the website?
They'll just go to the website.
Okay.
Or if you're not sure how to do it, call an agent, call somebody that knows how to do it, or you can go to the SHIP office. They can help you as well.
Explain SHIP office.
That's there's one down at the library where those are people who are not employed by an insurance company that just gives
free advice.
Free advice.
And many are retired people that have maybe lived their whole life. It's like, okay, Greg, you're a long way from it, but when you're retired at 65,
65,
then maybe,
yes. That's closer and closer every year. It's
I don't know how that happens.
I don't know.
But many of the volunteers or consultants for SHIP are people that have been in a profession that can counsel you very well.
Yes.
Okay, now we do want to remind you that Greg's going to be here with us again next week if you think of questions that you might like to ask. Let me show you once again the phone number and the website where you can get information about Medicare. And again, as Greg said, you can look at different plans. plans. You can look at different prescription costs. That's Medicare.gov, and give them a good look, and maybe you'll learn a lot. And again, don't forget, that's where you can also ask questions about how you can get your Medicare and you 2016 book. Greg, you have about 30 seconds to tell us the most important thing we need to know right now.
People who have Care Improvement Plus. This is a Medicare Advantage plan. It's been pretty normal or common in Northeast Indiana. That plan is exiting the market this year. So people who have Care Improvement Plus have to make a plan change. Contact somebody and see which way is the better way to go for them.
Okay, thank you for that, because I bet some of you have that situation, and Greg will probably remind you again next week. Meanwhile, thank you so much for
my
being
pleasure.
here. I always think I know something, and then I learn something new from you, and again, as it changes. We will be back next Wednesday night at 7:30. Meanwhile, health insurance will be the topic. That's 7:30 next week. We'll see you then.